What's up, everyone? I'm making this video to kind of address some of the first steps you can take if you're experiencing knee pain, really any kind of knee pain, but especially if you're a runner or a distance athlete, some preventative steps you can take. No, this doesn't necessarily fix or cure anything, but it's not going to hurt you, and I think by foam rolling, if it does help the problem, you can possibly weed out some things that could be going wrong otherwise. So it can't hurt to try. So first off, let's kind of talk about what the hell runner's knee is. I've heard it referred to as chondromalacia. I've heard it referred to as patellofemoral syndrome. Most people just generalize and call it runner's knee. Essentially, here's a kind of a crappy diagram, but when your muscles are at, we'll just say, normal length, your patella essentially can kind of glide up and down smoothly. Your kneecap can glide up and down smoothly. And if things are really, really tight, or we'll just use the professional terminology, they're all janked up. Essentially, this muscle here, nope, not that muscle, there we go, gets really, really tight, and rather than the kneecap being able to glide up and down smoothly, it's kind of getting pulled inward as it's trying to go up and down. So this creates a lot of friction and pain and swelling and all kinds of nasty stuff. So I'm going to go through the three muscles of the leg that I really focus on. Mind you, this is going to be subjective and different for everyone, but let's kind of move forward. The first is going to be, we'll just say, the front of the thigh, the rectus femoris, kind of a small little diagram, but basically right down the very front of your leg, stay off of your kneecap. So I'm going to run clip. I mean, some people have never foam rolled, so I'm going to run clip of what that looks like. Okay, so the rules are going to pretty much be the same for foam rolling, and there's a lot more complex data on it and tricks that you can do. So this is going to be really a 30,000 foot overview of it. Essentially, I'm going to have the roller, if I kind of back this up a little bit, right to about, come on now, right about here. So if I kind of zoom in, let's just say that hip bone is right about here, kneecap is right about there. I'm going to be playing right there in the middle. So if we move forward, kind of a messy video here, but I'm going to be going up and down very smoothly. I only do this one time for the sake of this video, but I try to spend a few minutes per area that I hit. Sometimes that muscle can be very stubborn, and it can take a few passes over it just to get the tissues to relax enough to where you can actually kind of work in there and let the foam roller act as that kind of self-massaging tool. Nice, smooth pace. One of the biggest things I see people do wrong is the foam rolling. They go super fast, they'll do one pass and they already move on. Take your time. I try to spend like 10 to 15 minutes a day foam rolling or just doing some type of mobility work. The second area is just to the outside. That's the lateralis. Again, the same rules are going to apply as the first one. I'll run clip, but all I've done is I've just slightly rolled my body to the outside so I can put a little bit more pressure on the outside. And you can put as much or as little pressure as you want. You can see that my this bent leg here is on the floor. If I want to put more pressure, I can kind of just shift my body weight or kind of move that leg in a way that puts more or less pressure on the area that I'm foam rolling out. There's no rule of how much pressure. The right amount of pressure is the right amount of pressure. Basically, if you're digging in there so much that you can't even relax and things are just feeling worse, take some pressure off or use a softer foam roller. If it's not enough, get a harder foam roller or try to put some more pressure on it. But again, try to spend a few minutes on each of these areas. Last but not least, everyone's probably heard of the IT band. The IT band is actually not a muscle. That right there is the IT band, and it is connected to a muscle up here called the TFL, or the tensor fasciae lata. or lati, however you want to pronounce it. We're going to want to roll that whole area out. There's actually some studies out there that people say you shouldn't roll out your IT bands. Again, do your own research. I don't think you're going to necessarily hurt yourself, but definitely roll out the tensor fascial out of the hip area of this. And then same thing as I did before, I'm just going to roll my body. So now I'm pretty much on my side. And again, you'll kind of see me move my leg around to put more or less pressure on as I foam roll. I don't have very tight IT bands, so I can really dig in there. Some people's are extremely tense. So again, as much or as little pressure as you need, but it should feel like the foam roller is able to kind of work in there. And again, spend a few minutes on this area as well. So again, let's say you spend 2 to 3 minutes on each of these 3 areas. That's going to be anywhere from about 6 to 9 minutes per leg, and this is just on the area, on the muscles that we've addressed. There's other muscles that we could talk about as far as things like running go. Calves generally get pretty tight. Hip flexors get pretty tight. That's for a different video. I've actually made a few videos on certain exercises, corrective exercises, hip strengthening exercises, and different mobility drills for things like hips and calves that are in my playlist. So look those up. Stretches would be the couch stretch. That's a really good stretch for the quads and hip. I did a video on, I think it's called tight hamstrings, maybe not, question mark, I think that's the name of it, but it goes into the difference between hamstring and calf tightness. And then the SL-Deal is a drill that pretty much universally is going to help you out. I'll be uploading a video soon called VMO Clocks, and that is a video that you should also check out, as it kind of relates to strengthening we'll say the abducting, stabilizing hip muscles that help with kind of the way your knee is positioned, as well as we'll just say knee position overall. And it also focuses on just the muscle the inside quad muscle, the one that generally tends to be a little bit weaker than the other ones, and that can also factor in. So way too many factors for me to list them all off, but this is at least a start on some things you can do just to work on alleviating some of that knee pain. So give it a shot. Let me know how it goes.